Hey, welcome to AgelessRx's introduction on aging skin. We're super excited to bring this to you guys today. And I'm Josh, I'll be your host. And we're going to have a great time today explaining exactly what differentiates AgelessRx and our aging skin lineup. And you don't have to hear it from me, you can hear it directly from our experts. So I'd love to give a quick introduction to our head of staff, like the entire brainchild of AgelessRx is here with us today. We're very lucky. Dr. Sajad Zalzala. So Dr. Z, I'd love to have you give a quick introduction.
Sure. My name is Sajad Zalzala, Dr. Z for short. I am the co-founder and chief medical officer of AgelessRx. We started this telemedicine platform about a year and a half ago, and been growing in terms of products and services that we offer. Our goal is to be kind of the platform for all things health, wellness, and longevity, with a focus on longevity, helping people live longer and healthier.
Fantastic. Thank you, Dr. G. And we also are lucky enough to have another expert in the field. Tara Thompson is a PharmD. She's also the VP of Clinical Services for our main partner in creating these products and innovation compounding. So Tara, I'd love to have a quick introduction from you as well.
Thanks, Josh, and thanks for having me here. Like you said, I'm a pharmacist. I am one of the clinical services VPs here at Innovation Compounding. And basically what we have done is partnered with Ageless to research and develop these great formulations that they are making for you guys. So we do all that here at the pharmacy. We are a 795 and 797 compliant USP PCAB accredited pharmacy. So we're so happy to be with Ageless today and bring you guys the best quality products.
Fantastic. And speaking of you guys, this whole presentation, I just want everyone to know who's watching. A lot of this has been prefaced by questions that have come directly from our patients. So the entire walkthrough of our product lineup is based with you in mind. And so the first big idea behind what a lot of people have been asking us is really, why does skin age, guys? Like, can you guys give me maybe a little bit of overview? Maybe Dr. Z can help us understand.
Well, I mean, the skin is one of many organs in the body system. It's the most apparent, obviously. It's probably one of the biggest as well. And because it's on the outside, it's the most susceptible to external factors. What you eat, whether it's smoking, sun exposure, smog. Even genetics have a component, but basically it comes down to the ability or inability, I should say, of being able to create various different proteins and fat structures in the skin, such as collagen and elastin, for example. As a person gets older, their ability to generate collagen and elastin starts to decline, and it just doesn't mesh as well together. It's supposed to be a nice, beautiful mesh, but as the skin ages, a person ages, that mesh starts to fall apart. So you end up with this, you get clumps and loss of elasticity, and that's when you start becoming, you have uneven skin tone, wrinkles, lines, things like that start to form.
Fantastic. That's a very interesting piece of background why it ages. But help me understand too, Dr. Lee, because I'm as director of e-commerce for AgelessRx. I'm really fascinated by the products. I love this stuff. So when we first started talking, we were like, hey, what are the best ways to really currently reverse aging? And then we started talking and we came up with this list. And so can you kind of give me some background about what drove us here and kind of what the current methods are today that are commercially available?
Sure. I mean, there are a lot of practitioners and providers out there who have all sorts of methods to help either rejuvenate the skin or at least give the appearance of skin rejuvenation. Some of these are you could find at kind of just a salon, for example, like chemical peels and things like that. Others are a lot more intensive, such as plastic surgery. Those are kind of on the extreme ends, I would say. But you have clinics doing Botox and fillers. Botox kind of paralyzes the muscles in a small way and kind of relaxes the muscles, so it kind of reduces frown lines and things like that. Whereas, fillers kind of fill in some of the voids where, like I said, where fat and protein and elastin and things like that has started to fade with age. Of course, you have you have laser technology as well that can help resurface. There's PRP, there's stem cells. There are all sorts of therapies out there. We decided to deploy therapies that are accessible, because that's kind of our model. Our model of our mission is to make these longevity and anti-aging therapies as widely accessible as possible. And so we've focused on topical therapies, easily deployable by telemedicine, and can be highly effective as a topical therapy, a cream.
Oh, that's fantastic. And Tara, I don't know if you had anything to add here, because I know we worked extensively on finding the right products for people, and I know that we had some conversations in the past even about what's making it so hard. So I don't know if there's anything you wanted to add to this slide.
Sure. So basically, I think the most important thing to remember is that we did all of our clinical research and our development of these products based on evidence and based on clinical literature. So we actually used studies out there that have been done on real patients, clinical trials, and found different ingredients that actually proved to make the skin look more firm, reduce aging, and that kind of thing. So that's really important to us here, both as product or medication developers, but also for you guys as the consumers and the ones who are using it, to know that these medications that are included in your particular creams that Dr. Z was talking about have been studied extensively in their particular strengths and dosage that we chose for you guys. So one thing I always go back to is that there's two ways that the skin ages. One of the ways is intrinsically, which means that that's just the gradual aging of the skin over time. It's a very long process. It happens with aging. It might be due to your hormones, just the gravitational pull of the earth on your skin adds to intrinsic aging. Just the way that different stressors in life, it's your aging from the inside out. And the second way that skin ages is called extrinsically or extrinsic aging. And that is due to outside factors such as UV light, us being out in the sun, and maybe not properly using sunscreen or just not knowing about it, or the environmental factors such as chemicals that are in the air or the ozone layer. Just little things like that can all add to extrinsic aging. And that is something that we were looking for products that both addressed extrinsic aging and intrinsic aging, because when you use a product or a chemical that helps with both of those processes at the same time, you're going to get the best results on your skin, because you're both treating it from the inside out and also from the outside in. And as we'll see a little bit earlier, we have a really neat diagram that shows the different layers of the skin, and you'll kind of see how the medications or the active ingredients that we're using in these creams are affecting those different layers of skin. So I just think that's one of the important things to always keep in the back of our minds to make the best quality product for you guys, to take all those things into account and choose medications that are going to be beneficial for that entire realm of aging.
Yeah, one thing to keep in mind is, I mean, the skin is, is an organ that turns over, where there's a lot of turnover to it. I mean, some organs have a lot of turnover, like the skin and the intestines, for example, and our other organs don't, like the heart and the brain, for example. But the skin is one of those that turns over rapidly. You see it when you slough off skin. A lot of dust in people's homes, actually dead skin that's been sloughed off.
Oh.
Yeah, so as a person gets older, their ability to sustain that turnover starts to decline, and part of it is we've talked in other presentations about the 9 hallmarks of aging and what causes them in terms of like genomic stability, telomeres, things like that. And so that kind of all is amplified in many ways with the skin, with skin cells, because of what Tara had talked about. And so some of the therapies, the therapies that we'll be talking about also kind of target this turnover to improve it and enhance it. And we'll talk a little bit more about that.
No, that's beyond interesting, because I'll tell you guys what, I was over the last summer holidays, I forgot a little bit of sunscreen, and I did notice that feeling, and I'm regretting it still today, but it's good to know that, we have medication out there that can help me get over some of those harsh skin burns that I've been dealing with too. So, but it sounds to me, interestingly enough, based on some of that I heard from you, Tara, is that it sounds like you're getting a combo approach. You're looking internally and externally, and I think that's the key takeaway that I'm getting to. And that's where I think those conversations drove us to what we're offering today in terms of our lineup. And so with our lineup, I just wanted to introduce this too for people that maybe aren't aware. So we have 2 critical products that we think that the medications between the 2 of those things can really address all of those features that you heard in the grandiose fashion from Dr. Z, maybe even looking at how they address the different hallmarks of aging. So the 2 big ones we want to talk about today are our DMAE firming gel and our Tretinoin anti-wrinkle cream. And, the first question you might ask is like, there's thousands and hundreds of thousands of skin products out there. Like, why would AgelessRx choose these, right? I mean, because there's so many options, so many different things that are happening. And so why would we, decide on these 2 products? And I think that's a fantastic question. I know that, between, Tara and Dr. Z, you guys probably have an amazing answer for us. So maybe Dr. Z will let you take the first shot, and Tara, you can definitely add some color as well.
Well, yeah, I mean, Tara had kind of hit the nail on the head there, talking about scouring the literature, looking for ingredients and substances that have scientific and clinical backing, and that's kind of where these 2 ingredients stood out. With their help, we've been able to formulate a great product line here.
Yeah, Tara, and maybe we can even talk too a little bit about why is it that we decided DMAE would be great as a topical skin solution when no one else has done this, right? I mean, this is a pretty novel idea. If you look it up, you cannot find anyone else that's really done this. So can you help us understand like why we thought this was such a great idea?
Yeah, so kind of what Dr. Z touched on, and Josh, you did mention it a little bit, but we looked at medications or drugs that had different mechanisms of action and how it related to the skin cells. So as you'll see, in some of these formulations, we use hyaluronic acid, for example. That is one of the medications that is naturally found in your skin, but sometimes it can kind of be lacking, or you cannot have enough of it, or your cell is little shriveled up because it doesn't have enough hyaluronic acid. That's just kind of an example of, a mechanism of action that we use. But with DMAE and the retinoids, or the vitamin A derivatives, they actually target this cell in different ways. So be it cell turnover, be it cell plumping, be it kind of working at a deeper layer of the skin to push those cells up and decrease the fine wrinkles and that type of thing. We use all those different mechanisms of action. And we picked DMAE because it does have a really interesting mechanism of action in dermatology, especially when it's used topically on the skin. And I think we'll get to that a little bit later as we deep dive into the drugs. But basically, I'm always thinking mechanisms of action, because if you can find out which drugs affect the cell the best in terms of wrinkling and firming and increasing the light or increasing the appearance of the skin, if you can find those mechanisms and you can find the drugs that match up with what you're wanting to do with the skin, then that's the best way to make these amazing combinations that they don't interact with each other. They're meant to be used synergistically, which we'll talk about later. But mechanism of action to me is one of the most important things behind clinical literature and finding the drugs that fit those certain end goals that we're looking for.
Fantastic. And, the other big, I think, idea from this takeaway is that, we also listened, right? There's a huge request out there from the, the longevity community saying, hey, my biggest concerns really are with wrinkling and with firming of my skin, right? Because as we age, as you just heard from, our experts, that skin doesn't perform as it used to. And the goal with these two products is to get that performance right back to where it was. And so I think that drives us to the next question of, well, why did we do these two now, right? And I think that's a really fascinating approach. And maybe Tara, you can lead us with this one of like, why is it that we're actually thinking that this is good now?
Well, as we all know, there's a ton of different skincare products out there. There's ones that you can purchase over the counter that have ingredients in them that, can help your skin and moisturize and that type of thing. But there's so many to choose from, and they're all in a way kind of similar. A lot of them have some of the same ingredients, just in different maybe dosage forms or bases. But the reason that we did this now is because we wanted to do something different. We wanted to find different medications that were safe but still effective, and to put them on the skin and put them in different combinations or in different strengths or even in different bases that made more sense for the skin. So that's kind of why we came up with this. Another great thing is that this is prescription only. This isn't something that we can go out and grab off the shelf. These are prescription strength, and these are made in our compounding labs. So they're made very specifically and very specially with the highest quality of oversight and quality assurance. So that's really good to know that your products are being made in those particular types of labs that are paying really close attention to everything that's going into the product. So I think now is just the time to find a better solution, to find something that wasn't out there on the market, and to find something that had clinical evidence behind it and literature to back it up.
Yeah, I mean, what I like about working with compounding pharmacists is their dedication to, to quality, the potency. If they say that something's going to be in there at a certain potency, they test for it, and they have third-party testing, and they also, do all sorts of testing and quality assurances. You won't find that with over-the-counter products. That's very rare for an over-the-counter product because it's not required. There's no oversight. Sometimes, I mean, not to say there's not good quality over-the-counter products out there, but just the level of oversight, the level of quality control from a compounding pharmacy, especially ones that are registered at the level that innovation is. I mean, you just can't find that in an over-the-counter.
Yeah, that compounding with care aspect, I think, is just underrated, completely. And, getting into it, I think one of the more interesting things is that there isn't a one size fits all either, right? There's not just, hey, one product will fit for every single person. There has to be a level of personalization at every client level. And the interesting thing is, if you start thinking about the introduction of tretinoin, right? This one is very different. I'm very excited to talk about this because we've all heard about tretinoin. We've actually seen it. I'll let Dr. Z talk a little bit more about the FDA uses, but there is a ton of really interesting data and background information on tretinoin that makes this such a powerful anti-wrinkle cream, but only if you do it the right way. There is no one size fits all. So I think that's a perfect segue into really the questions that we were getting from our clients, right? And, I'm going to kind of fire these off because there were a lot of questions that we've gotten, right, about tretinoin. And, I think Tara and Dr. Z are very well situated to answer a lot of the deeper, I guess, pharmaceutical-based questions on this. So, I think at a high level, we'll be answering some questions that you guys have. Like, what is tretinoin? What does tretinoin do? You heard a little bit of a teaser about why do we do RX versus OTC or over the counter. But really it comes down to questions on what is actually in the cream, and then really why should anyone be interested in this product at all, right? What makes this better than just going and getting your traditional OTC product? What is making this so impactful? So Tara, I'll kind of breeze through this slide and I'll pull up some highlights that you provided, but would love for you to give some background, some information, and maybe how we can address some of these answers for our customers.
Yeah, absolutely. I think one of the most important things to know is that tretinoin was actually initially studied in acne. And then in those acne trials, they were finding that it was actually improving the look of the skin, not just from an acne standpoint, but from a coloring, from a reducing wrinkles, helping with, your aging spots or your fine lines, your 11s and your crow's feet. And so once it was studied for acne, they were like, wow, look at this drug, everything it's doing outside of just patients with acne. And then it started getting into more of a cosmeceutical type realm. So the interesting thing about tretinoin is that we talked about earlier intrinsic and extrinsic aging. Tretinoin, it's a vitamin A derivative. It actually tackles both intrinsic and extrinsic aging. So as you'll see from this picture right here, there's different layers of the skin, and Dr. Z can talk a little bit more about this because he's actually seen it in person. But there's more superficial layers, and then there's deeper layers of the skin. And tretinoin, the one thing we love to why we work with tretinoin so much is because it actually is easily absorbed down into those layers of the skin. That's not the case with a lot of other drugs. Sometimes drugs are too big in molecular size that they'll just sit on the top of the skin. They won't drive through, or they're not specifically designed to go into the cell, but tretinoin is. You might have heard it called retinoic acid or the retinoids or vitamin A derivatives, but those are all kind of the same thing, the same words for the same drug, but in pharmacy, we call it tretinoin or retinoic acid. They're the same thing to us. But yeah, it's easily absorbed into the skin. One of the really interesting mechanisms of it is that it gets old skin cells, as they die off, they get replaced with newer skin cells. So like Dr. Z was saying earlier, there's skin cells under skin cells, and they kind of push each other up until the top ones are sloughed off. Retinoic acid kind of speeds up that process. And it's those superficial dead skin cells on top that are causing all of the fine lines and wrinkling. There is a deeper aspect to it as well, but we need that top layer off so that we can actually get the new, bright, and healthy, plush skin cells to be visible. So that's all I kind of really have on that. Dr. Z, do you have anything to add?
Yeah, I mean, as you mentioned, it was originally studied in acne at a higher concentration, and then if for more longer term use, I mean, at the higher concentration, it's not advised to use it for longer term just because of that higher concentration, and so when actually one of the things that we warn patients when they actually start retinoic acid is it might cause a little bit of peeling of the skin, a mild peeling or irritation of the skin, and part of it is because it's increasing turnover, and that's part of the reason why we always start patients on a lower concentration, so a 0.02%, and then if they tolerate that well, then we move them up to the 0.05. So there is kind of that sweet spot dose there, as opposed to when treating acne, you do 0.1%. So, about double, between 2x and 5x the strength of what's needed for anti-aging. Again, because we're doing it more for a long-term, smaller doses of a longer term. But I just kind of wanted to warn patients because we've had, that is a common concern. If patients are not warned ahead of time, they say, hey, this is causing my skin to peel. As long as it's mild, it's part of the process.
Yeah, absolutely. And I think one of the other really neat parts we were talking so much about mechanisms of action and how it works in the skin. Dr. Z, you mentioned earlier about collagen and elastin. Those are two components of the skin cell that are very important for a healthy looking and ageless looking skin. And there are things that actually degrade collagen and elastin over time, called matrix metalloproteinases, or MMPs is what we call them. And one of the mechanisms of action of tretinoin is that it decreases those MMPs, so they're not breaking down your collagen and elastin as much. So we're also, in addition to helping cell turnover, we're decreasing MMPs. So another interesting mechanism of action in tretinoin.
Sure, and then there's obviously there's inflammation. Inflammation is a big part of aging as well, and retinoic acid is thought to be an anti-inflammatory for the skin. And again, inflammation kind of drives some of this damage. The cross-linking of proteins, which reduces their function and things like that. So it really is a great molecule overall. We make it even better, or I should say innovation makes it even better by adding other ingredients such as vitamin C, ascorbic acid, hyaluronic acid. I just also want to point out that hyaluronic acid is also prevalent in the joints, and it kind of and there actually are injections using hyaluronic acid and some of their derivatives that go into the joint and kind of basically it's a very complicated molecular structure. And the main function is to absorb water and to kind of give that plumpness. In the case of joints, it kind of cushions the joint. In the case of skin, it kind of hydrates the skin and provides moisture to it.
Interesting. So we could really equate this to being essentially the gold standard for an anti-aging skin cream compound. And I think with the added benefits, like you just mentioned, of the extra ingredients, it sounds like it's something that just about everyone should try. So I think that's all well and good, guys, but that's just us saying things, right? I think actually the more powerful piece too is the research and the studies that have gone into this, right? It's an incredible amount and undertaking to actually truly understand those different things that Dr. Zia and Tara were actually bringing up about how do we know, right? It's one thing to say it on this awesome WebEx that we're having, but it's a totally different one to actually study this and truly understand the science. So actually, I wanted to put out a couple of these highlights of exactly where we saw these things working. And, maybe you can just give us a high level overview here.
Sure. I mean, kind of go back to the other ingredients. I mean, in this case, the case of this cream, kind of tretinoin or retinoic acid is kind of the superstar, the star, and then these other ingredients are kind of supporting actors, so to speak. But yeah, I mean, there's a lot of literature, a lot of science to back up retinoic acid. We've just kind of pulled a couple here to showcase. 2019 study showing that vitamin A's derivatives are the most effective substance at slowing down the aging process. And that kind of led to the FDA approval of it, not only as an acne medication, but also kind of a cosmetic agent as well. And, in 2012, there was another article, again, showing tretinoin as, being effective for the prevention of wrinkles. I mean, they were even saying, patients who utilize Botox and fillers and things like that, it's still important for them to consider using these sorts of treatments as well. And like I said, we can kind of go on and on about studies. There are numerous studies out there supporting vitamin A and its derivatives, and specifically tretinoic acid. And that's why we feel confident that this is a science-based, science-backed, science-based evidence approach to healthier skin.
Fantastic. And one other interesting thing you guys have both brought up as I pull up the actual what's behind our exact tretinoin, is this base, right? It's not just the active ingredients, it's also what makes this base so special. And Tara, I would love for you to give us a little bit of insight as to why this is such a differentiator for us.
Absolutely. So when you're mixing any kind of drugs together, especially ones that go on the skin that are so crucial to the way that you look, you're putting them right on your face, you have to be very specific in choosing a base that has many different factors. So it has to hold all of the drugs. And when I say hold them, they all have to mesh well into that base. There are some bases you cannot mix drugs in, they don't dissolve correctly in. So when we were going through the development process of these particular medications, we were using different bases that were specifically designed to be put onto the skin. The important thing about knowing those, differentiating those bases from other bases that you may use vaginally or in the mouth or in other places of your body that aren't visible to the sun, you have to take into effect that you want a non-comedogenic base as well. Comedogenic just has the ability to cause comedones, which are basically, Dr. Z can get into the like medical terminology of it, but basically it causes your skin cell or your pores to kind of clog and that type of thing. We use non-comedogenic bases. So these will not cause your pores to clog. These are designed specifically for the face. And also ones that are free of the harsh chemicals that you hear about, putting something on your skin that shouldn't be there, like alcohols that dry out your skin, or certain preservatives that might cause reactions or just might not be good for your overall health. Those are all factors that we consider when we're choosing a base. So the base that was chosen for this, out of many ones that we tested, trialed, went back and forth on, was an anhydrous base, which means that it is not water containing. It actually has a very, very smooth texture. It doesn't have a texture at all. It's like basically like a cloud. I've felt it many times making it in the lab, but it's almost like you're putting a cloud on your face, and it holds all of these ingredients very, very well. It just has such a smooth finish, and it's so perfect for the skin. It's not heavy. You don't feel like you have something hanging off your skin after you put it on. So those are all really important factors, because not only do you want it to work and do the job that you actually came here to get it for, but you also want it to feel good on your skin. You don't want to put something on your skin that you're going to be uncomfortable in, or that smells a certain way. This is actually scent-free. It's very, very light. It's anhydrous. It's very important when I say anhydrous, because sometimes things that contain water can not last as long, or they can get contaminated. We wanted an anhydrous base that would last a really long time and didn't have the issue of anything like happening to it or growing or evaporating or something like that. So all of those factors definitely, and we'll talk about another base that we use later called a gel base, which is absolutely fantastic. But those are some really interesting things about particular base selections.
Could you talk a little bit about like the importance of the base for the actual absorption of the active ingredients?
Oh yes, absolutely. So another factor, I talked about many, but there's always so many factors. There's probably more that I'm not thinking of today, but one of the factors is its penetration enhancer. So you want to make sure that you're using a base not only designed specifically for the skin that had all of those factors that we talked about earlier, but also that helps the drug drive into the skin layers. So we saw that picture earlier that had the stratum corneum, which is in your entire epidermis. You have your dermis, more superficial layers, and then your lower layers like your dermis. But that drives the drug down through all those layers of cells. Because remember, the top layer of your skin is usually a dead skin cell like layer. And so what we want to do is get past those dead skin cells into the ones underneath and help revitalize your healthy skin cells to come forward to the top. So this particular base, out of a couple that we were going back and forth on, this one was the one that seemed to hold the drugs best, felt the best, smelled the best, was the drugs dissolved beautifully in, had a great color, and also was a good penetration enhancer, which is just a factor that we use. There's other factors if you want to get into like Fick's law of diffusion and that kind of thing, but for this particular base, was the one that showed the most promising effects in terms of safety and efficacy.
Fantastic. So yeah, I mean, I think we can see this one as essentially the gold standard, as I said. And if we're thinking about gold and the standards, then I think the newest addition is the up and comer that's potentially gunning for the top anti-aging and longevity, topical cream spot, which is, I think, a great segue into a lot of the pieces that you already mentioned, Tara. But the next product that we're really excited to really talk through is DMAE. I'm actually going to ask Dr. Z a lot of the similar questions here. As long as same with you, Tara. We had a lot of the same similar questions, which drove us to want to have this exact kind of webinar platform, so that everyone could kind of get all their answers all in one spot. And as you can see, we had a lot of the same questions about like, what is DMAE? It's an acronym, it looks like, but maybe it's not. I'll hold the phone there. What does DMAE do? Why do we get RX versus OTC DMAE? What is actually in this cream, and really what makes this a good medication for each person that's potentially interested in. And really the goal when we're putting these products together and envisioning them is we're thinking back to the requests that we've had from our customers. Number one, we wanted to address wrinkling, and number two, we wanted to address firming. This one is really key on the firming side. So Dr. Z, I'll turn it over to you first, and Tara, feel free to jump in as well.
Sure. So DMAE is stands for dimethyl aminoethyl, DMAE for short. Basically, yeah, it is a mouthful. Yeah, it's actually one of the easier chemicals to probably pronounce. There are some out there that are like 50, 500 letters long. Anyway, but basically what it is, it's a peptide, or a peptide derivative, I should say. It's very similar, or it's a form of a vitamin B called choline, and that the chemical structure kind of allows it to be absorbed more easily in the skin, it has anti-inflammatory properties and a lot of other properties that make it very unique. Interestingly enough, it's also available as an oral supplement. It's been around for a while. It's been studied for, actually I learned about DMAE decades ago, a couple decades ago, when it was popular for like a cognitive enhancer and other potential features. And when I heard about it as a skin cream, I'm like, that's very interesting, but it makes sense. So we're kind of taking this very promising molecule that has a lot of good research behind it, and I think we're Innovations, I think, one of the only compounding pharmacies that utilizes DMAE for this application. So it seems to be a very unique offering, the retinoic acid is more for wrinkles. This is more for firming, to help kind of firm up the skin. And Tara can talk a little bit more about that as well.
Yeah, and one other thing too is that, again, this is such a novel idea, right? That's I think the key takeaway from you, Dr. Z, if I understood you correctly, is that no one else has been doing this, right? And the reason is unknown to us, right? We actually looked at the science and we worked with the experts to actually formulate something that no one else has made available, especially not on an RX personalized basis. So, maybe Tara, you can help us understand a little bit more about some of the detailed science behind the pharmaceutical aspects. What makes DMAE actually play nice with your skin, right?
Yeah, so if you remember, we talked about intrinsic and extrinsic aging. So intrinsic kind of happening from within, extrinsic due to outside factors on top of the skin. DMAE is just another great example of one of the drugs that helps target both. So one of the great things about DMAE and a reason that we put it into this formulation is because it is easily absorbed into the skin. That's very important because like we said, a lot of drugs aren't easily dissolved or easily penetrated into the skin. So sometimes you can buy those over-the-counter products and put them on and they just sit there on top of the skin, but we want something that's going to go in and actually do the work. This actually, DMAE, one of the cool mechanisms of it is that it builds on the skin's moisture reserve. So it's actually going into the cell and using the moisture that you get from the gel that it's in or the cream that it's in, or just from, your natural body having hydrogen and oxygen in it to help plump up those cells and decrease those fine wrinkles and those lines that are around your skin that you don't want. So it's kind of instantly hydrating and it's plumping. So it's giving you that smoother appearance. That's what it's all about, getting water into the cell to make your face look better. It helps with wrinkled and sagging skin. DMAE is fantastic. We use it in some face washes. We use it in some under eye creams. It really helps in also underlying facial muscular tone. So if we're looking at this from a muscular standpoint, there's tiny muscles all over your skin, underneath your skin. And so it's actually helping with that as well. And then one of the things Dr. Z talked about a little bit earlier is inflammation. So DMAE is actually also an anti-inflammatory agent. It helps decrease inflammation in the cells. Inflammation in terms of bad inflammation, not good plumping of the skin, but actually inflammatory particular factors within the cell that cause it to be inflamed. And if it's inflamed for too long, it'll die. So we don't want them to die. We want them to stay good and healthy. So DMAE is one of the great ingredients for that. It's also very safe. It's a very safe drug. So we use DMAE in a lot of formulations, but never really topically on the skin for anti-aging. So I think this is a really interesting, there's clinical literature behind it. There's evidence behind it that shows that it has definitely, mitigated forehead lines and fine wrinkles, help with lip shape and overall appearance of aging skin. And another thing that we talked about, the dermis, which is like kind of a not deeper layer of the skin, but underneath the superficial layers of the skin, helping with that thickness and the collagen stores that are there. So I know Dr. Z will go over some research and studies in a little bit, but from a drug perspective, DMAE is the perfect fit for a topical skin preparation. And not only that, but because we're combining it with other ingredients in that preparation, they're all working synergistically and they're all using their different mechanisms of action to come to the same common goal, is to help the look of your skin. So DMAE is also it works well with others. It plays well with others. So we're able to mix it with other ingredients and it not have any chemical reactions or drug interactions. So that's another very important thing to remember when you're putting things on your skin. You want it to all play nice together. So
only we could take some notes from DMAE. We could all play
yeah.
so well together, right? And I
life.
think that's a fantastic way to really think about it too. Is that when we started really thinking about this too, we wanted to make sure that we're providing access to groundbreaking new products, right? Like there's nothing like this, and I think I want to emphasize that there's nothing like this that exists today, because we were willing to really roll up our sleeves and do a lot of this research. And I know, Dr. You and me did a ton of homework and background on this, and you have led us the right way, I think. So I would ask you to maybe explain a little bit more about the studies that actually prove that this was a good idea, right? This is something that people should be really looking at to address their anti-aging, especially the skin.
Sure. I mean, well, DMAE is a naturally occurring substance. The human body makes a little bit of it, but it's found at much higher concentrations in fish. And so, a lot of people think about fish, they think about like omega-3. Well, this is kind of another health benefit of fish. And so we have our fishy friends to thank for that. But again, I mean, looking at the science, looking at the clinical trials, we kind of list them here, and it's on our science pages as well on our website, AgelessRx. There's a 2005 clinical trial that showed improved underlying facial muscle tone and kind of reinforced that notion of the anti-inflammatory effect of the skin. There was a randomized control trial, using DMAE for 16 weeks, shown to be safe, efficacious, mitigating the forehead lines, the 11s and the crow feet that patients like to refer to a lot. And then again, I mean, another skin about how it can help form a barrier. And I suspect that's probably one of the functions that why it's high in fish, is because of that barrier that the fish need when they're in water. Again, I mean, that's kind of why certain fish have high omega-3 content. It's likewise certain fish have high DMAE content. From a safety perspective, I mean, I've seen studies where they've used doses up to 1,600 milligrams orally, and there doesn't seem to be any adverse reactions or anything like that. Again, part of it is because it's naturally derived. So when used topically, I mean, it's even safer because the dosages and things like that are quite a bit lower than even the highest doses or even moderate doses you might use orally. But again, it's all about target. I mean, when you're using it orally, you're using it for one reason. When you're using it topically, it's kind of going right to the skin, right where it's needed.
Interesting. So what exactly is in this? And I know I heard a little bit of a teaser, right? From Tara about the gel based. It's a little differentiated here. But building on your point, Dr. Z, I think what's in it makes a difference, right? And that's the key, is that how these ingredients are all playing well together in their ecosystem within the product itself, right? And then love, Tara, maybe for you to give us a little bit more color as to, from the pharmacy perspective, why is it the DMAE plays so well? Why is it the nice kid in the sandbox in terms of, the facial ingredients here?
Well, the particular formulation that DMAE is in, actually, DMAE, hyaluronic acid, and alpha lipoic acid are all three kids playing nice together in the sandbox. So they are all wonderful ingredients. They work off water, they work off hydration. One of the really, really cool things about this formulation is that it's in a gel base. And it's not even really a base. It's more so we're using water and these other ingredients, especially hyaluronic acid, which forms a gel naturally if you use particular concentrations with water. And it forms its own gel. So it's really interesting to see in a lab, because we're putting all of these powders together and then we're adding water. We're letting it hydrate. And hydrate just means everything is absorbing the water. And then once it's spun down to for a particular time and speed, it actually just comes out as this beautiful gel. There's no particles in it. Everything is dissolved. Everything has absorbed the water in its chemical structures. And then you're putting this on your skin, and it's just so hydrating to your skin. It helps firm your skin. It's cool. It's like it dries really quickly. It even has a hint of lavender to it. I don't know if you can, you'll see it when you see it, or you'll smell it when you see it, but it's just a wonderful product. We always love making this because it just fills up the whole room with very light good. It's a very clean smell. And then we put just a little citric acid in it, which is ascorbic acid or vitamin C, to help with preservatives. So that's our natural preservative. It helps with the pH. It helps keep bacteria out because they don't like to live in an acidic environment. So actually using vitamin C as a preservative is one of the huge value adds of this medication. It's just a tiny amount, but it makes such a huge difference, because then we don't have to use preservatives that keep it, that we're putting on our skin. So a very, very basic but so important combination of drugs, but basic base. It's just water and everything else, that all these drugs that are making this beautiful gel. So I've seen it. It's beautiful. It's so cool to watch and just know that it's basically water that you're putting on your skin, and then it has these drugs dissolved into it.
Yeah, I mean, we've already spoken about hyaluronic acid previously. Alpha lipoic acid is a very interesting molecule. Again, I've known it for years, and I've used it clinically for years for neuropathy issues. Diabetics who have damage to the nerve. Alpha lipoic acid can help mitigate some of the damage to the nerves. But the reason why it works with nerves is because of the anti-inflammatory effect. It's a very potent anti-inflammatory and a fat-soluble one as well. So it works really well in the skin to help quench some of that inflammation damage that can occur because of environmental factors and such.
Yeah, he's exactly right, because we haven't talked about ALA, or alpha lipoic acid, but it's photoprotective. So it's actually helping protect your skin from UV rays. So we should go into that more next time.
Really
yeah, we could spend an entire lecture on ALA, but but in this case, it's kind of a supporting actor.
Yeah, and I think the big question too is that, especially for more of a novice, let's say someone watching this maybe doesn't understand too much about why it's a good idea to put acid on your face, right? I mean, I think that's a really key takeaway, is that it's not always the way that it seems, right? These acids are actually working in tandem with your body's natural chemistry, it sounds like, to really bring out the best in your skin and continue to improve it over time. And one of the most interesting things is we actually we're for the first time ever revealing something that's we're really proud of, because we do a lot of testing on this stuff before we bring it to market. And one of those areas of testing was actually on someone we know pretty well. So Dr. Z, I'd love maybe you can give a little background on this. We actually have a patient of ours that's a good friend, and they were okay with giving some insight as to their experience with the DMAE, since it is such a novel product.
Yeah, I mean, this is Jade. She's one of our health coaches at AgelessRx. I've worked with Jade for many years, and she kind of volunteered to provide some of our before and after pictures. But she really loves the stuff. I mean, she sent me pictures. She's like, "Hey, Dr. Z, how can I get more of this?" And you know, you know, she told us that she noticed the difference in the plumpness of her skin. You know, you know, only after you know, a relatively short time. I think she was only, these were only about 4 weeks apart in terms of the pictures. You know, her crow's feet and the number 11s kind of started to improve. You know, laugh lines, things like that. And again, that kind of goes back to what we've been talking about from the beginning in terms of firming the skin. And you know, we have you know, other before and after pictures as well, kind of show from a personalized patient perspective how effective these treatments, when you get the science right, the results show.
Absolutely. I think they absolutely show. And this is a really powerful image. I think the big takeaway too is that this is only 4 weeks. You know, 4 weeks is an incredibly short amount of time in the grand scheme of, you know, skincare. And you know, some of these results we've seen have just been absolutely incredible. And you know, people have been raving about this. And that was the big point of why we wanted to have a real brief, like, you know, discussion on really the overview of these 2 core products. But we also really wanted to continue addressing a lot of questions that we get, right? We wanted to make this more regular thing where we're actually answering a lot of these questions. And, you know, I have a couple of them here that are pulled up. And I think the first one, maybe Dr. Z, I'll send it over your way. You know, why get these products through AgelessRx?
Well, like I said from the very intro, is our mission at AgelessRx is to make longevity and anti-aging products as widely accessible as possible. You know, we have a specially designed telemedicine platform where we kind of match patients with our our providers who have training in prescribing these products. And we also have unique partnerships with pharmacies such as Innovation and others to bring these products to patients easily and accessibly. And like I said, currently we're focused on prescriptions. And again, that power of the prescription is, you know, can't be stated enough in terms of the importance of quality control and things like that. So that's why AgelessRx, you know, accessibility, affordability, quality, and also content. I mean, because we are a medically focused organization, you know, our part of our mission is education. That's why we're doing this webinar today. But we have a lot of articles and content on our website, and that library is growing day by day to help you know, educate patients about the options for them to live longer and healthier.
Awesome. I think that's exactly the right reason why AgelessRx is a great partner to identify a lot of these new solutions for customers. And so, you know, I know we've touched on this at a very, very high level and all the way down into the weeds. But, you know, if you could just, you know, concisely just explain to people maybe watching, you know, what exactly makes these so different than going anywhere else? Like, what makes this so special for AgelessRx?
I think it's the amount of research and really attention to detail that went into developing these products and finding the perfect ingredients that worked well together, that worked at different mechanisms of action on the skin synergistically. So we're not doing 1 + 1 = 2, we're doing 1 + 1 + 1 = 10. Basically, we're getting a synergistic effect with all of these meds together, and then choosing those perfect bases that are going to work best on the skin for these medications that are in there for every patient, and ones that actually feel good to put on. And then also, these aren't available anywhere else. You can't get these over the counter. These aren't something you can go grab off the shelf. They're very specifically made. They are prescribed by a physician or by a provider who you will see. And they are made exactly for you guys. So these are something that you can't just get anywhere else. And I think that's very important to know, that if what's working, what's not working for you over the counter, or what's you've heard stories on of your friends or your parents or whoever might be using these over the counter products who might not be seeing results, you're actually getting a prescription strength medication with drugs in it that you know is in a great base, that's safe and effective for you. So
Fantastic. And so since these are so special, and Dr. Z, I know we have, maybe one other product that could be in this line, but we chose to omit because it's not so new. The real question is, are these effective and safe and everything to use together? Because that was a big question. People want to get the most bang for their buck, like Tara was saying, the 1 + 1 + 1 = 10. They want these synergistic effects. So are these effective being used together?
Yeah, so the other product you talk about is our NAD cream. We've had out for a while now, and it's been very popular because of its effectiveness as an anti-aging agent for the skin. We also have other NAD products, but that's a different talk for a different day. But yeah, absolutely. I mean, we went out of our way to formulate these products so that they're complementary to each other. So there's absolutely no reason why you couldn't kind of get that additive effect. The NAD one does one thing, tretinoic acid does another, the DMAE does a third thing, and they're all synergistic. Like Tara said, 1 + 1 + 1 = 10, and that's exactly the case here. We have an article on our website that talks a little bit about how to apply them together. They are absolutely, like I said, compatible with each other. You can either stack them up, use more than one on the same day, or you can alternate days is another way to do it. Although obviously, the more frequently that these are used, the quicker results will show. So to answer your question, yes, we formulated these specifically so they can be used together.
Awesome. That's, I think, news to everyone. I think that's fantastic news to share as well. And so the last real question is, hey, can people get access to these things today? Because these sound like they're life-changing products for folks. So maybe Dr. Z, you can give some overview, I guess, on how can people get these today? Like, what does the process look like? And how can people really start combating that anti-aging interface today?
Sure. So, head over to AgelessRx.com. Like I said, I always encourage patients to read about the science, figure out what products they'd like. We also have a longevity assessment, also known as a longevity quiz, that helps guide patients if they're not sure what they're looking for. But if they're looking for these specific products, our website is easy to navigate, and there's a medical intake process. There's a secure electronic medical record that patients complete, where patients complete an intake, and for some patients, depending on the state, may be required to do a brief phone or video consultation with the prescriber. Others can be just done completely online. After that intake process, a prescriber like myself will review it, and if it's appropriate, then we'll generate the prescription for the patient. And we provide, one of the advantages of doing this in a medically supervised manner is, we have all the education materials. We have great support staff. We actually answer the phones when you call, we answer emails when you email. We have a secure patient portal. If there's any questions, any issues, we help with troubleshooting and follow up and such. So it's not, again, when you buy something, online, over the counter, once you buy it, usually that's it. I mean, it's kind of like, you're on your own at that point. And because of our medical model, we provide a lot more support and guidance and education materials.
Excellent. So yeah, I think the biggest takeaway from that is, hey, start your consultation today. Jump on over to AgelessRx.com. You can check out all the other products that we have to offer. This is the first of probably many of these webinars that we're going to be offering. We really just wanted to give you guys some real insight as to what's driving the thought process and the product development here at AgelessRx, but also help you guys put some faces to the name, right? I mean, Tara's been great. She's been awesome in helping us really put together the right solutions for our unique community of customers. So truly appreciate that from you guys. And with that, I just want to say thank you. for watching. Thank you, Dr. Z. Thank you, Tara, for taking the time today to really help educate people on the amazing opportunities that are being brought to us, to our community through people like you guys. So, hats off to you guys for all the, tons and countless hours that you guys have put in on this. Could not be happier with the results. And, we're really, really excited for people to get access to this. So with that, thanks. Have a great day.
All right. Thanks for putting this together, Josh.
Yeah. Thank you, Josh.